Okay, I think we're going to go ahead and get started. Welcome, everyone. Today, we're going to kind of address some of the little things that are on the back of our mind, considering it's Hurricane Preparedness Awareness Week. I like saying that. Just making sure that everybody is as safe as we could be, considering this year is a little bit different, even for us seasoned Floridians. Today, we have Joan Rivera. She is actually a professor over in our Emergency Administration and Management program. And she's actually going to run through with us some important things to know to be prepared this season. Joan, are you there?
I am. Thank you so much, Erica.
No problem.
All right, I'm going to go ahead and put up the PowerPoint. And I think everyone can see it. If you can't see it, let me know. So the title of the PowerPoint is, what do you mean we might have a hurricane? Isn't a pandemic enough? And it kind of feels like it's been pretty eventful so far already this year. So a little bit about me. As Erica said, I'm an assistant professor. My program that I actually am in charge of is the AS degree in Emergency Administration and Management. I also teach in the Fire Science AS degree as well as a Public Administration with a concentration in Emergency Planning bachelor's degree. My background is public health preparedness as well as epidemiology at the health department. So I spent 17 and a half years with the Florida Department of Health and did a lot of really cool stuff. And this is kind of, this is my jam here, you know, hurricanes as well as a pandemic. I mean, this is really cool stuff, fascinating stuff to me. So this is one of my favorite songs, and this kind of made me think of 2020. This is from a show that many of you are probably way too young to remember. It was called Hee Haw, and it goes, gloom, despair, and agony on me. And it ends with, if it weren't for bad luck, I'd have no luck at all. And that kind of seems like what's been going on in 2020 so far. You know, there's been so many things, so many challenges that people are facing, along with the pandemic, of course, the economic downturn from the quarantine. I know many of you may have been struggling. And there are a lot of resources out there. So I know Erica has been working really hard on the CARES Act for many of our students. If you're not sure about how you're going to pay for college or what you can do, or if you have other financial issues, reach out to me, reach out to Erica after this is over. I've got a lot of resources I can refer you to. There's programs out there. I don't know if it'll be able to do everything you need it to, but there are a lot of programs out there that can help you. So please let one of us know. All right, so realities. I'm a realist. You know, we hear people say, oh, you're an optimist, you're a pessimist. That glass is half empty, that means you're a pessimist. The glass is half full, that means you're an optimist. So when I look at a glass of water, it's just half a glass of water. So I'm a realist, and realities is what I like to deal with. I like to deal with how are we going to address those realities? What can we do to overcome them? I'm a planner by trade. And our new reality is COVID-19. And we're going to learn a little bit more about COVID-19 in this presentation. And our seasonal reality, of course, in the state of Florida is hurricane season. So when those two collide, it could actually be more than just a perfect storm, because everybody knows that a Category 5 or Category 4 hurricane are actually perfect storms. I mean, they're gorgeous to watch as long as they're not impacting you. But the amount of damage they can cause is tremendous. And thinking about how to prepare for such a powerful storm in the middle of a pandemic really is going above and beyond what we might consider an opportunity for a worst case scenario. So we're going to learn about COVID-19, how to prepare for it, how to address it. We're going to learn about hurricanes and what we can do to prepare for them during a pandemic. So let's start with a little bit about COVID-19. So you've probably heard the term COVID-19 is a novel virus. So what is a novel virus? So a novel virus means it hasn't been previously identified. So it's not something we're used to. It's not something we've seen before. Being novel is important because that means we don't know a whole lot about it. We don't know how it reacts to the human body. We don't know how it reacts to different people. And by that, someone who has diabetes, you know, I'm meaning someone maybe who has an autoimmune disease, someone who's a smoker, someone who's a marathon runner, someone who, you know, maybe has other issues that we're not quite sure weren't pre-identified. We like to call comorbidity is what we like to call something when you have one disease or another disease or something happens at the same time. So some of the numbers you've been seeing for the deaths with COVID-19, you'll hear the term comorbidity of diabetes or comorbidity of COPD. And what that means is they had pre-existing conditions that a comorbidity, they now had COVID-19 along with it. So even though they may not have died from the diabetes or from a COPD, the COVID-19 kind of put that disease over the extreme. So it's taken now what they previously had, that comorbidity with the COVID-19, and the COVID-19 has actually wound up costing them or resulting in them not being able to survive the diseases that they had. So that's why we're seeing death counts where people are like, well, they had, diabetes or they had COPD, so they really didn't die from COVID-19. They actually did, because the diseases that they had previously, they were managing and they were still alive. But when they got COVID-19, that comorbidity, the mixture of those two diseases is what actually took them over to the next, which actually winds up taking their lives. And that's why you're seeing the death count rise with COVID-19, because of those COVID morbidities. All right, so again, sorry, got off track a little bit. Let's go back to how novel virus is important. So, we don't know a lot about it. We don't know how it reacts in the environment. We don't know what surfaces it lives on. We don't know how long it lives on these different surfaces. We don't know what the symptoms are. We don't know what the infectious period are. How is it transmitted? How long is it contagious? Does a person who have the disease but is asymptomatic, are they able to transmit it? Are people who have antibodies, are they able to re-get the disease if they've had it previously? Do we know is about vaccines, what works, what doesn't work? These are all unknown when we're talking about a novel virus. And this is why you'll see sometimes the guidance change. You may see things like they say one day, you can do this to prevent it, but the next day it's not recommended. Just know that as we learn more about COVID-19, you'll see changing recommendations. This is not uncommon. This doesn't mean they're giving you false information. It doesn't mean they're lying to you. What it means is every day we learn something new. Every day with a novel virus that we study it, we research it, we see what the impact is, we see how it's impacting different people, what it's doing in the different environments. We're learning. And as we learn this, we're providing that information to make sure you're getting the best information. So these continuous updates, these continuous guidance, this is all about making sure that you're getting the correct information that is the newest information. So it's not like the previous information was incorrect or it was a lie. It was just the fact that that was information that now we've continued to study it and we've got new information we want to share with you. That's important. So just know you'll see guidance change. Try to stay updated on the information. You always want the most up-to-date information. And later in this presentation, I'm going to give you several websites that you can get information from. All right. So the second part of COVID-19 is, what is a coronavirus? So coronavirus, they're a large family of viruses that are common in people and many different species of animals. Okay. And these animals include camels, cattle, cats, and bats. Rarely an animal coronavirus can infect people. So what we know is that there are certain diseases like MERS and SARS and so forth that previously were transmitted animal to animal, okay? And then they mutated, and now they go from animal to person. And then the mutation that we fear the most is when that novel coronavirus goes from person to person. And that's what we've seen with COVID-19. So we've seen the virus, which is in the animal population, and it usually goes from animal to animal. It has mutated just enough where it went from animal to person, and then it mutated just enough again where it can be transmitted person to person, okay? This is not what we like to see, because when this happens, your body doesn't have the antibodies inside of it, doesn't have the immunities built up for this. You haven't been exposed to this type of virus before, because it occurred in animal populations, not people populations. And this is something we do get very concerned about, because our bodies are not ready for this. It's a novel virus that came from a coronavirus, and we know it has mutated from animal to animal to person, and then person to person. So this is very concerning. All right, so the virus that causes COVID-19 is spreading very easily, and it is sustainably between people. So the reason those two key features are important is when you're looking at new viruses, or actually any type of virus, the way that we kind of judge how bad's it going to be as far as transmission, not how bad the disease is going to impact us or what our mortality rate is going to be, but how many people are going to get it and so forth. We're looking at how the virus spreads from person to person, how contagious is it, and we also look at how sustainable is that spread from person to person. Okay, so let's break that down. So a highly contagious disease like measles is very it's very easily spread. So if you were to walk into a room, let's say that I had measles and I walked through a room, if you walked into that same room within a couple hours of me leaving it and you didn't have antibodies, you've never been vaccinated for it, or you didn't have, some type of preventative measure to keep you from getting it, you actually could get measles. That's how highly contagious measles is. Okay. So walking through a room and then you walk through it a couple hours later. So this is pretty scary stuff when it comes to measles. Now, measles doesn't have the same mortality rate as other diseases like Ebola and so forth. So Ebola isn't as highly contagious as measles, but Ebola has a much greater mortality rate. More people die from it. Okay, so you're looking at how contagious is it? We know that the COVID-19 actually does spread very well from person to person. Okay, so we know that. We know it is contagious and that contagion is sustainable, meaning that spread from person to person continues. It's not a couple people in a cluster get it and then it's over. Nobody else is getting it. No, it is going to continue to spread in the population until we come up with a vaccine. So it's kind of concerning when we're looking at, okay, it is contagious. It's not as contagious as measles, but it's more contagious than other diseases. And it does have a sustained spread from person to person. So we know it's something that's going to be in the population for a while. We know it's something we need to address. And the way we're going to try and address it is through certain recommendations that the CDC has given out, as well as working on a vaccine. So how is it spread? So it's spread through droplets. So droplets are interesting, right? We think of droplets spitting on someone. We think of sneezing on them, coughing on them, okay? Droplets can be seen, but droplets can also not be seen by the naked eye, okay? So one of the reasons that we have social distancing, 6 feet is a recommendation, is because what they found is that the droplets which spread COVID-19 don't seem to carry more than 6 feet. So having that standing 6 feet apart is keeping you from getting COVID-19 or keeping you from being exposed to those droplets from someone who does sneeze or cough, because most people don't sneeze and it goes 6 feet. All right. The other side of that is when we talk, we have the strong consonants STs together, like the stand and the ths and stuff. When we're doing that, even though we may not think about this, we actually are exposing and having droplets of our saliva come out. So those also fall if you're staying at least 6 feet away. It's keeping you safe because those droplets are heavy enough where they should fall before they get to if you're 6 feet away. Now, of course, if someone spits on you, that's a whole different ballgame because many people can spit more than 6 feet. So we're not going to spit on anybody. All right. So it is spread through these droplets, and staying 6 feet away is a precaution. These droplets can land in your mouth, your noses, or on people and can be inhaled. We also know that it can spread from being on, well, the research is showing that it spread from if a droplet has fallen on certain types of surfaces and you touch those surfaces when the droplet is still infectious, and then you touch your eyes, your nose, or your mouth, okay? Because you have, basically, you have permissible membranes there. And when you have something on your hand and you're touching your mouth, your eyes, your nose, and you haven't washed it, then whatever's on your hands is being exposed into your body. So a disease like COVID-19 that is pretty contagious, that has sustainability with transmission, when you're touching that virus and putting, and then wiping your hand, your nose, or your eyes, you're actually kind of taking that virus in. So we want to be very careful about that. And we also know that COVID-19 can be spread from people who are asymptomatic. And asymptomatic means that they don't have symptoms, which is kind of concerning because even though we're testing, who are we testing? Most of the people we're testing are either our first responders, our medical providers, or people who have symptoms. So there's a large population out there who have probably been exposed to it, who are asymptomatic, who may be carriers and could expose people. They're still conducting research on the asymptomatic people to see if they're called super spreaders, which are people who can spread it quickly. So far, the research is kind of here or there. Some say yes, they can be. Some say they can't. So we're still learning. And again, this is something we're going to continue to learn. And as Erica put in there, if you have any questions, just feel free to type it in or raise your hand throughout this process. So COVID-19, we want to make sure we're staying informed about COVID-19, especially as we approach hurricane season. How are we going to protect ourselves and others? So COVID-19 has already taken the lives of more than 100,000 people in the United States. And when you average in all the numbers across the world, it's been pretty bleak. A lot of people have passed. And when I'm teaching my classes, I like to tell my students, okay, so if we had to deal with 5,000 deaths, how bad would that be? And my students are at times like, well, that wouldn't be too bad. Then I say, okay, so in this room right now, if we stacked up bodies side by side, person on top of person, how many bodies could we fit in this room in a normal sized classroom? We could probably get a couple hundred. And when I give them that number and they start thinking about 5,000 people who are dead, it's a very overwhelming thought. So we have well over 500,000 people in the world who've died from COVID-19, well over it. So a lot of people are losing their lives, but this is still a pretty low mortality rate, which means still pretty low as far as people who have passed. It's higher than what we see in seasonal flu. So percentage-wise, more people have died from seasonal flu than have died from COVID-19 in a shorter amount of period. But we also know that it could be worse. There are certain viruses out there that we are concerned about in epidemiology and infectious disease that actually have a 60% mortality rate, which means 60% of the people could pass from it. So luckily, it's not that bad, but it is something we need to take serious, especially if we have loved ones, okay? So we need to make sure that we're maintaining our social distance. I already explained to you that 6 feet apart. It's so important that you stay 6 feet apart. Now, your family members that you live with, you're pretty much probably are exposed to what they have. At the CDC website, there's some information on staying social distancing, with your family and so forth. Actually, I think I included the link here. I did for you. So in your household, if you're living in close quarters, there's things that you can do, again, to continue to keep yourself safe, even if you can't keep 6 feet away. And a lot of that has to do with what we're about to go through there. But for the most part, when you're in public, you should be looking at 6 feet apart, staying from people, okay? You need to wash your hands with soap and water as often as you can. The most effective thing you can do to prevent the spread, along with the social distancing, is to wash your hands with soap and water for 20 seconds. And when I say wash your hands, I mean really wash them. Don't kind of squish, squish, done, okay? You need to get under the fingernails. You need to get inside in the cracks and crevices, get in between your knuckles, get around your knuckles. I like to go up above my wrist and do that for 20 seconds. Maintain that good lather, okay? The other thing is when you're done washing, don't take the hand that you just washed and turn the water off, okay? You need to make sure that when you're done washing, you rinse your hands, you grab a paper towel to dry your hands, and you use that paper towel to turn the water off, okay? The same thing with paper towel. You need to make sure you're not touching a clean hand to where the paper towels come from. So when you go to the bathroom, when you come out, go ahead and use your hand to get the paper towel out already, or wave the hand to get it to come down. Wash your hands with the soap, rinse them, take the paper towel, dry your hand, turn the water off, okay? And when you're leaving, use your foot to open the door. Don't use your hand to open the door. This is really important. So as I told you, my background is public health preparedness. We did epidemiology and so forth. So a lot of the diseases we dealt with were diseases that were fecal oral transmission. Fecal oral means fecal is fecal matter, which is poop, and then oral is mouth. So when you're thinking about fecal oral, means that poop has gotten in someone's mouth. People aren't eating poop when they get these types of diseases. What happens is people are going to the bathroom. They're not washing their hands after they've wiped themselves. Then they're touching different surfaces. You're touching those same surfaces. And when you grab the fork at the restaurant, then you sneeze into your hand or you touch your eye, that's fecal oral transmission. You now have been exposed to something that was transmitted from poop into your body. Okay. So, and I know it sounds really gross, and it really is, but there's a lot of diseases that are transmitted that way. And I got to tell you, we see those diseases every day at the health department. So every day people are getting diseases because they're not washing their hands. So if you think that hand washing is not important, I'm going to tell you, it is so important. If you could take, if you could see the different ickiness on the different things in the world, you'd never touch anything again. It is really pretty gross, the different germs that are out there, okay? So wash your hands, wash your hands. If you don't have soap and water, hand sanitizer. Hand sanitizer needs to be at least 6% alcohol, because the alcohol is actually what's killing or actually gets off for you and so forth. So make sure that when you buy it, you're reading the label. If you can't find hand sanitizer right now, there's a lot of really good videos out there on how to make your own hand sanitizer. My husband's been making his own, so we haven't been able to find regular alcohol. So he's been going to the liquor store and he's getting, pretty good alcohol, 150 proof. It'll take the paint off your car, but he's been using that along with some aloe vera from the dollar store. So he's been making his own alcohol, his own hand sanitizer. We've been giving it to family and friends. we've been making sure that people are staying stocked up. And the same for you. If you can't find it in the store, just get a video, get some alcohol from the dollar store if you can, and some aloe vera, mix it together in the amounts that they say. Need to make sure you routinely clean and disinfect frequently touch surfaces. So frequently touch surfaces, doorknobs, handles in the door, refrigerator areas in your house and stuff. Anywhere that you think people put their hands, you need to make sure you're cleaning routinely. So within your home. Now, outside of your home, don't touch it unless you're sure it's been cleaned. Or if you do have to touch it, use a Kleenex, a napkin, something, or make sure that you're hand sanitizing your hands pretty quickly, using the hand sanitizer afterwards to keep you from touching that and touching a semi-permeable membrane in your ears, your mouth, your face, or your nose, okay? This link that I have in here, and I'm going to share this, actually, it's in the website, and I'll send it to Erica, and she can post it for you, but this link right here, let me find the link. I'm trying, okay, do I have the little, okay, though I do. So this link right here talks about the different areas that you can, the different types of things that you can use to disinfect. And then this one gives you a list of EPA agents that actually will kill COVID-19. So it's going to be important that you take the time to look at these when you get a chance to see what actually kills COVID-19. And there are certain things that will not kill some viruses. So COVID-19 is pretty easily killed. So a lot of other things, a lot of our things that we have in the market currently will kill COVID-19. But if you're not sure, you're just going to go to this website right here that I'm circling, and it'll tell you what it will and won't kill. Okay, this is a good resource too if you have somebody that comes down with Giardia or something like that in your house, you're not sure what to use to clean up and so forth. This is a good website to keep as a resource for you for future reference. Now, when you're cleaning something, you want to look at contact time. Contact time is how long does your cleaning agent have to stay in contact with that surface to kill that, the virus. Okay, some disinfectants and some cleaners say 1 minute, 2 minutes, 3 minutes, 4 minutes, 5 minutes, 10 minutes. Okay, so look at the disinfectant, see how long it says a contact time is, and know that once you spray it on, you have to leave it on there. So if it says contact time is 5 minutes, you have to spray that agent on, and then 5 minutes later, it should still be wet when you come back, and then wipe it all down. Then that means that you've actually disinfected that area. If you spray it and wipe and the contact time was 5 minutes, then you have not disinfected it. Okay, you may have removed some of the virus membranes because it is droplet based, so you may have been successful in removing some of the virus itself, but the virus could still be there, and not just that virus, but a variety of different viruses. So this is a good thing to look at anytime you're using a cleaner, is what is the contact time for that cleaner. Okay. And then you can learn more about protecting yourself from the CDC, and I'm going to give you additional websites later on. When you're coughing, you want to cover your mouth and nose with a cloth face. You also, the same thing when you're sneezing, and you want to monitor your symptoms. I want to talk a little bit about masks real quick. So to mask or not to mask, that is the question. So should you wear a mask? Is it optional? Well, what I keep hearing from friends is I have a right not to wear a mask. Then I hear from other friends, well, I have a right to tell them they need to wear a mask, they need to protect me. So what I'm going to tell you is, we live in a society that we need civility. What's going on right now? We've proven time and time again that civility is really important in all matters. And when it comes to COVID-19, it is no different. When you wear a mask, you're not protecting yourself as much as you're protecting those around you who are at risk. Now, the guidance from the CDC and the research they've conducted does show that wearing a mask helps prevent the spread of COVID-19. And that's because it's droplet based, remember? So if I'm talking into a mask and I have my hard consonants, my st's, most of what I'm saying is going into my mask, so it's not going out into the environment, okay? So there is some research to show it does decrease. Now, it doesn't stop it altogether. And I also want to talk a little bit about what types of masks you have. So you have the face masks that you wear that are being created. People are sewing. These things are really cool. But again, it's protecting other people around you. You have surgical masks, which when you go to a doctor's office, if you're coughing or sneezing, they're going to ask you to put that on. The reason they ask you to put that on is for the same reason that you would wear a cloth mask that somebody had sewn for you, and that's to help prevent the spread of what's coming out of your mouth and your nose. Okay, so that's to help protect others. And then you have then you have the respirators, the N95 masks, and these are things that nurses and doctors wear. Now, N95 respirators are just that. They're respirators. They're hard to breathe through when they're fitted correctly. You are, so when I was at the health department, I was in charge of fit testing people for N95 masks. And fit testing is a process you go through to make sure the mask fits correctly. So think in terms of that mask needs to be secure enough that it prevents 95% of the particulates from coming through the perimeter. So where it touches your face, preventing it from coming through when you're breathing in, okay? So when I do a fit test for someone, I give them the mask, I have them seal it up around their face, around their nose and their mouth. I put a hood over them, and I have like an inhaler that I squirt a sweet tasting, it's called saccharin, or a sour tasting entity into there. And what I do is I have them move around, I have them talk, I have them jump up and down. And what I'm trying to see is if that mask is sealed up good enough around them to prevent them from tasting what I've just sprayed in that hood, okay? And if it does, if it prevents them from tasting that, then that means they have a good seal. So those N95 masks, those respirators that doctors and nurses wear and stuff, they have to have that fit testing to make sure it has that perfect seal to keep them from getting the viruses. So any type of, again, 95% of particulates are supposed to be prevented from being inhaled when you're wearing those masks, but it has to be fit tested. I caution you from getting those for several reasons. One is because they're not really effective unless you've been fit tested, okay? Number two is because before you're fit tested, you have to have a doctor approve that it's okay for you to be fit tested. They're very difficult to breathe through. So if you're wearing a respirator and you have asthma or you have other breathing issues, it's gonna make it very hard for you to get a good deep breath, okay? So it's actually dangerous for you to wear, okay? And the third reason I caution you not to get any is because nurses and doctors use them, and sometimes, like right now, you know, they're not in the supply they need, okay? So if you want to do keep yourself safe, then you're going to do the social distancing, you're going to do the hand washing, all right? And then when we're in the community, we got to remember these are also things we do to protect others. It's about protecting those most vulnerable. When we wear our I have a Mickey Mouse mask that my sister made me. When we wear our mask in public like that, the cloth mask that people are making, or some type of barrier, we're protecting those most vulnerable. We're protecting the seniors, we're protecting the children who can't you know, who would be quite vulnerable to different diseases, people with autoimmune diseases, people with other diseases that may make comorbidity of COVID-19 just not possible for them to get through the fight of their life if they were to get it. So wearing a mask or not wearing a mask, it's not about you, it's really about other people in the community, and civility is what it's all about. And I hope that makes sense to you. If not, again, all you got to do, my number, Erica has it. All you have to do is just let me know if you want to talk more about that. All right, so this is something I wanted to put in to the slide to give you an idea of the 6 steps for safe and effective disinfectant. So the first step is to make sure that the product that you use is going to kill what you need it to kill, okay? Now, as I said previously, COVID-19 actually is pretty easily killed by things. You know, you can use a solution of, I think it's 4 teaspoons of bleach with a quart of a water, and that will kill it. Bleach kills almost everything. But you're gonna, whatever you're using, look to see on the EPA website that I gave you, is it actually effective against that virus? We're gonna read the directions. What does it say on that bottle, okay? How are you gonna do it? Do we need to pre-clean the surface? If so, it should say in the directions that you're gonna need to pre-clean it. And then we're gonna look at our contact time. And again, that's in the directions. What's the contact time? 1, 2, 3, 4, 5, 10 minutes. And we wanna leave it on there for that contact time. All right, and then we're going to wear gloves if we need to wear gloves, okay? You know, you don't need to wear gloves for COVID-19. If you are not wearing gloves, you want to make sure you're washing your hands well afterwards, okay? And then make sure when you're done using the disinfectant that you lock it up and you keep it out of the reach of children as well as pets. Many of the disinfectants we use are actually harmful to people, and they can actually kill children and animals. So be very cautious with them. Now, I put in the little video here of donning and doffing gloves. We're not going to watch it, but this is a good video, and I put the link down here because I think once Erica shares the PowerPoint with you, you're not going to be able to watch the video inside the PowerPoint, so you're going to copy this and paste it. The key factors you need to look at, or the key points when doing this, is notice that he's pinching right here, the outside of the glove, and he's going to peel that down in a way so that this part of the glove, which is dirty, doesn't touch his clean skin, okay? And then when he goes to the next hand, he goes under the glove and then he peels it off, like he peels it back, okay? And then he throws the glove that way. It's very important you know how to don and doff gloves if you're wearing gloves. Because if you're putting gloves on and you're just taking them off willy-nilly, you're actually making it probably worse on yourself because you're having the rubbing and the stuff and the germs that are on the outside of gloves are on the inside of your hands, and you have a false sense of security because you're wearing gloves and you're like, oh, I'm good, you know, I'm not going to get it now, but in reality you are because you didn't don or doff the glove correctly. And donning means putting it on, and doffing means taking it off. All right, so let's talk a little bit about hurricanes. All right, so hurricane response has changed a little bit. Well, actually, quite a bit. The messaging you're going to hear this year is going to be a little different. It's going to say only shelter as a last resort. Now, this does not mean don't go to a shelter. This means if you have other options, use them first. So if you live in a mobile home in an area that floods, they're not saying stay there and die. What they're saying is you have a family member or a friend that lives in an area that is not going to be impacted, or in a house that's secure that's not in a flood area. If so, then that's going to be the first recommendation, okay? So again, the messaging you're going to hear does not say don't come to a shelter. It says check now to see if you have other options than a shelter, because sheltering should be a last resort. All right. And the reason it should be a last resort is because we know with COVID-19, we need to do social distancing. Okay. We need to have 6 feet of space between people. And this is going to be a challenge for shelters to be able to get that. Okay. So again, when you hear the messaging, just know it doesn't mean you can't go to a shelter. It just means only go as a last resort. So plan now, take a look now, talk to friends, talk to family members, see if they have a home that's not going to be impacted and, you know, and is not in a flood area, see if they can take you in for the duration of the hurricane. You need to prepare. So to prepare for hurricanes, it's a little different. Again, it's a little different. We know what we need to do. Got to get some supplies, right? Your supplies this time also needs to include a face mask, because you're going to have to wear a mask if you go to the shelter. Infection control things, the disinfectant we just talked about, okay? Hand sanitizer, hand washing, whatever it is that you're doing for COVID-19 to keep yourself safe generally with COVID-19, you're going to need to have those supplies when you go to the shelter. And you are going to be asked to wear a face mask. You are, when you get to the shelter, you know, going to be asked to keep your area clean and disinfect your area and do hand sanitizer at all possible. Okay. And right now, some agencies are thinking they're going to try and supply these things, but for the most part, agencies are saying they just don't have the supplies they need to do that. So you're going to be responsible for doing that. When you get to shelter, it's going to be a little different this time around. I don't know when the last time was you went to a doctor. Many of you are probably a lot healthier than I am. But when you go to a doctor now, they ask you, have you been around anybody who's had COVID-19, who's been coughing or had a fever? Have you been out of the country? Have you been exposed to it? You know, and they give you a series of questions. They're going to ask you those same questions when you come to the shelter. They're also going to take your temperature. Now, if you have been around them, someone who's exposed to COVID-19, or you are coughing or have a fever, they're not going to put you in the streets. They're not going to say you can't come in. What they're going to do is they're going to put you in an area of the shelter that has additional people who have those same, who have also answered yes to those questions. So you're going to be in an area that it's not a true quarantine, but you're in an area where other people may have had some exposure or may have symptoms that they've said. So you're going to need to protect yourself again, mask and infection control type stuff, okay? And then you need to stay informed to be prepared for hurricane season. You need to know what shelters are open. Because of the way that sheltering is going to work now, you know, it's not the same as packing 500 people in a gymnasium now, because we have to stay 6 feet apart. Families need to be 6 feet apart. So they're going to have less people in shelters, which means they're going to need more shelters. So stay informed, know what shelter you're going to be reporting to, okay? Know what time the shelter's open. Know what you're expected to bring to the shelter. Is there supplies that you have, supplies that you don't have? If you don't have the supplies, call them and say, hey, I don't have the supplies. I don't have any other options. I have to come to the shelter. What do I do? Talk it through with them, okay? Communication is really going to be the key here. All right, so you need to have a plan in place. And again, I love plans. So your plan should begin with knowing the threats that are going on. Okay, you need to do your threat assessment. So COVID-19 and hurricanes. That's your threats, okay? So you need to know what is hurricane coming. Is it a category 1, 2, 3, 4, and 5? I mean, those are big differences, right? We know if it's a category 5 and it's moving slowly, well, actually, category 5 in general is going to wipe out most things in its path. But if it's category 2 and it's moving slowly with a lot of rain, then we're expecting floods. If it's a category 2 and it's moving really quick, then we'll probably have a day of flooding, but not like a week-long flood event, okay? So stay informed, know what the outcomes are, look at think in terms of surge, think in terms of rainfall, think in terms of how long they're saying the saturation is going to last. When you're watching the news, listen to these things because that should affect your planning. If you live in an area that doesn't flood, but you're expecting, 25 inches of rain in a week period, it doesn't matter if you're in an area that's going to flood, you're probably going to flood, okay? So know the difference, listen to it, understand what they're saying and how it's going to impact you. All right, so once you know what the threat is, then you can start looking at supplies, okay? Hopefully you've already started buying for hurricane season because it really is painful to go out and have to buy the things that you're going to need to go to a shelter right away. So I recommend is make a list of things that you're going to need if you need to go to a shelter or if you need to evacuate to a certain area, okay? Buy a little bit each week, okay? Don't go out and buy $400 worth of stuff. If you know that you're going to need batteries for the flashlights that you may take to a friend's house if you have to evacuate, or if you need to go to the shelter, then go to the dollar store, okay? Dollar store batteries are great. This is what I do this time of year. I go and I get the dollar store batteries. They're not going to last me 3 years like the Energizer batteries, but I'm going to pay a tenth of the amount, and they're going to last me enough to get me through hurricane season, okay? So if I know I need canned foods, I go and I buy canned foods that I love to eat. That way, if we don't have a hurricane, or if there's certain things on my shelf, I can rotate the stock. So if I know I like beanie weenies, then I'll buy beanie weenies. Every time I go to the grocery store, I may buy a can. That way, if I eat a can here, eat a can there, I'll still have cans that go with me to the shelter. Water, we know comes off the shelves pretty quickly. So if you can buy a case here or there, what you need to think about is 1 gallon of water per person per day. So if you plan on evacuating or plan on being sheltered in your home for 5 days and there's 5 people in your house, you need 25 gallons of water. That's a lot of water, okay? But you need to plan that time. Going out and buying 25 gallons of water at the same time you're buying 20 cans of food is a lot more expensive than just say, I'm gonna buy a gallon here, a gallon there, and have what I need, then rotate it in and out, okay? So what supplies, identify what supplies you need. Identify where you're gonna go. Are you going to a family member's house? Are you going to go, or if you don't have any other options, you're gonna go to the shelter, and plan accordingly. If you can go to a family member's house, you don't want to go and expect them to feed you. So you're going to make sure you talk to them ahead of time about either working with them to give them some money or you bring the food with you for you and your family, okay? If you're going to go to a shelter, ask them ahead of time. What do you need to bring? Are they supplying food? Some shelters do, some shelters do not. But you need to know ahead of time because showing up if showing up without food when they're not supplying food is actually not a good thing, right? All right, talk to your family. What about your family? Do you have children? Are there adults you care for? Do you have your parents, your grandparents you help out? Do you have animals? All right. Put these people into your plan and your animals into your plan, okay? If you're going to evacuate, what does your child need? If you're going to evacuate, what does your mother need? Are there medicines that he or she needs to bring with them? If so, talk to the pharmacy. Make sure you have what you need during that time. Animals, bring food with you for the animal. Bring pee pads. Know that when you take an animal to a shelter that accepts animals, you're going to need vaccination records. You're going to need to have a kennel, okay? So talk to the shelter that you may think about going to ahead of time. Please, please, please do not leave your animal at home during a storm. Do not tie them up. If you're not sure what to do with your animal during a hurricane, reach out to local humane society or call your local emergency management, okay? I don't want you to lose your animal. I don't want animals to be left behind. the phrase that you should think about is if you go, they go. Take them with you. What about your work? Talk to your boss ahead of time. What are the expectations? Do they need to have your number? Are they going to call you? If your phone doesn't work, do they have a backup number for you? Are you supposed to call them? If they're saying the hurricane should blow over by Thursday, they may say you need to call us Friday morning and we'll tell you if you need to come to work. So talk to your employer ahead of time and find out what the expectations are. And then what about school? Talk to your faculty, talk to your teacher, your advisor, okay? Most professors I know are willing to work with you after a storm, okay? Most, but you have to talk to them. I know during the last couple of years ago when we've had hurricanes come through and stuff, I've had students that, were overwhelmed and I didn't hear from them for, 3 weeks. But when I did hear from them and I kept sending them messages, hey, you okay? Do you need some information? What can I do to help you? When I did hear from them, they're like, well, I just thought you were going to fail me. No, I'm not going to fail you. I want to give you time to pass, but I need to know what you're able to do. How can I help you be successful? Many faculty will do the same thing, but if we don't know what's going on, then we can't help you. So talk to your teacher, talk to your advisor, ask them what a good plan would be. Talk to them before the storm to see what they're thinking about doing. Are they going to give extensions? Are they going to, change things up? So, but do that ahead of time. Okay? All right, so here's some planning resources for you. And then again, there's a lot of links in here that you can look at. So preparing for hurricane season, COVID-19 pandemic, it talks about different requirements for sheltering. So this is good information for you to look over to see what is required, what's going to be expected. Again, with this information, make sure you also talk to your local emergency manager, okay? Because they take guidance like this and then they do planning for their counties. So you need to communicate with them if you have questions. Here's some planning resources. Make sure you have a plan and it's current and updated. It needs to include all your family members, okay? I got a lot of information on here on where you can go get plans, ready.gov, floridadisaster.org, American Red Cross, FEMA. Be prepared. Talks about getting a go kit. What do you need to put in your sub kit when you leave, okay? And then go to hurricane, www.ready.gov hurricane to see more information. Here you're going to find about how to prepare your home, what a hurricane watch means, hurricane warnings, okay? What to do 24 hours out, 48 hours out, and so forth, okay? Real good information. Here's a list of supplies, and this is from the FEMA brochure ready. This is not the most comprehensive list. What I recommend is go back to the resources from this slide. Look at the different supplies, see what you will need, what you think you won't use. Like you're not going to need a fire extinguisher when you go to a shelter, okay? But depending on what kind of disaster you got going on, you may need a fire extinguisher. If you have a house fire, not like huge house fire, but like if your stove kind of catches fire or something, okay? So take a look at these supplies, but also look at those websites. Here's more information on preparedness. If you have pets, take a look here to see pet-friendly hotels, animals, and what to do for pets and animals you need to evacuate. And again, if you're still not sure what to do, get with your local emergency manager. If you can't get a hold of them, please get a hold of me. Right before a hurricane every year, I usually get 10, 12 students from different faculty members are like, hey, my professor said to give you a call because I'm not sure what to do with my dog. Find out now what to do with your dog, okay? And if you're not sure what to do with your dog or your cat, call me and let's see if we can come up with a plan together. This is where I got information from COVID-19 for you. Make sure that the information you're getting is from a science-based website, a factual, and with that information, you're going to want to make sure that you look for the most up-to-date information. The thing I like about the World Health and CDC is they have all this information as they continue to update. You'll see it listed by dates, so you can see what the most up-to-date information is, all right? This is a great little website here, Florida Department of Health Surveillance and Guidance. It's a list of all the different diseases that are reportable in the state of Florida. Any disease you could possibly think of, there's good information there for you. And I'll show you that website. Let me see how to do this. All right, so I want to share application screen. This is a screen I want to share. All right, so this is a website. And these are the alphabet course. So this is what the top of the website looks like. But you come down here, and if you want to know more about anthrax, you would click on A, and there's anthrax, and then tells you information about anthrax. You want to know more about measles, you would go to measles. You come down to measles, and here's information about measles, okay? And it's really cool website. If you're into diseases and how they spread and what you can do to prevent them and different things like that, all that information's right here. It's cool stuff. So, you know, if you want to learn more about different diseases, that's the place to be. All right, now I'm going to go back to my PowerPoint. All right. Sorry about that. I know that looks really weird, right? Okay, there we go. So these are all websites that I would recommend you take the time to look at now to be prepared. It's all about being prepared. Remember, we talked about you got to know your threats. You know the threats right now. Right now, our two realities are COVID-19 and hurricane season. So you need to be prepared for both. And the way to be prepared is identify what resources you have, what can you do to keep yourself and your family safe, and come up with a plan on how you're going to do that. You have to implement that plan, okay? So here's information depending on what county you live in. You can actually go and register for the alerts. So here's River County Emergency Services. This is their website where they post Indian River County related emergency management stuff. And this is where you sign up for Indian River County alerts. And I've got information for Martin County EM as well as Martin County alerts, information for Okeechobee County Emergency Management. Okeechobee doesn't have an alert system. I thought they had one, but when I went to their website, I couldn't find one. So they're asking you to listen to these websites. St. Lucie County Emergency Public Safety and St. Lucie County Alert System. So if you have not already signed up for alerts in your county, again, take the time now to do it. It's hard to do things when the storm is 24 hours out. You have time now to prepare to be ready. And when you are prepared and you are ready, it's less stressful when it does happen. I'm not going to say you're not going to be like, oh man, this could get bad, but you are going to be like, okay, I know what to do. I have my plan. I contact my Aunt Louise because that's where we're going to go stay with her. I put together my supplies in the bins I'm going to take with me. I call my mom and dad and let them know where we're going to be, that kind of stuff. So take the time to do that now. And if you're not sure how to develop a plan, again, the resources I gave in here will walk you through the development of a plan. But if you still have problems, just let me know. All right, so you need to have in the plan, you need to think about what supplies you have, what supplies you need, where are you going to go, who will go with you, people, pets, what supplies does everyone need, not just you, everyone who's going with you. How will you protect your home and your property? Is there anyone else you may need to help protect their home and their property? So along with protecting your home and your property, I recommend before you evacuate your home or before you do anything, even before the storm makes landfall, even if you're not evacuating, take your phone, walk around and do an inventory of everything in your home, okay? A lot of people don't do inventories because they don't want to say 27-inch TV, here's a serial number. All you have to do is with your phone, record TV, then go to the back of the TV where the serial number is, okay? You have an inventory if you do that. All right. How will you stay informed? Are you going to sign alerts? What websites you're going to look at? Is there more information you need to be informed? And how can you help others? And this kind of goes with this one. Is there anyone else you need to help? If you're responsible for caring for someone, you know, find out ahead of time, do they need help? What do you need to help them with? And if you plan correctly and you put out all your ducks in a row now, you're going to have time to benefit not only yourself, but those in the community. And I'm a big one for volunteering. And if you need volunteer hours, or if you're thinking about, you're just graduating, you're thinking about, you know, what am I going to put on my resume? Because I don't work in that field yet. They like to see that you volunteered. And anytime there's a disaster, especially hurricanes, there are thousands of opportunities to volunteer. So you can volunteer before by maybe reaching out to a church. Do they have members in the church that need help boarding up? You know, reach out to the Council on Aging. Do they need help getting meals out to people? Because right before a storm, you know, they're not just delivering 1 or 2 meals, they're delivering 20 meals or whatever, okay? So, but reach out to different agencies and see if they need help pre-storm. During a storm, shelters need staffing. Most of the people that are in shelters that help out, you know, the staffing, we used to have 20, 30 volunteers from the Red Cross. Those numbers are dwindling. They need volunteers, so, and especially helping with the shelters. So take the time to call your emergency management, see if they need help running a shelter, working at a shelter. And then after the storm, there's such a great need. Again, reach out to emergency management, see what kind of needs they have, see who you can hook up with the volunteer. They will coordinate that with you. They have something called ESF 15, which is Emergency Support Function 15, which is donations, volunteers, and donations. And they will be the ones to coordinate for you to go out and assist people. So if you have time and if you're able, help those. You know, I'm going to give you a quick thing. So think about your grandparent maybe, or someone you know in the community that you care about that's in their 80s or 90s, okay? If there's two of them in the household and they're going to plan on their house is secure, they're not in an area that floods, but they still need to get the supplies and they're told to get 15 gallons of water. Can that 87-year-old, that 90-year-old get that many gallons of water on their own? And the answer is no. Can that same person put up a 40-pound piece of plywood? And the answer is no. So what they find themselves doing, either they don't prepare and they pray it's not going to happen, or they go to a shelter. And again, when they get there, they're not prepared either. Okay, sorry about that. But take the time to help those most in need in your community. All right, and do I have any questions?
Thank you so much. That was awesome. Oh, wait, we have a hand. Rebecca, go ahead.
Yeah, okay, going back to the COVID, is Florida, because you read certain things, under producing the numbers of deaths because they're not adding the ones with the morbidities? Is that true?
Yeah, so one thing that we know historically, anytime we're dealing with deaths during a pandemic or a disaster, is the numbers are going to get larger as we go further, because we haven't been testing well. You know, we haven't been testing nearly the amount that other countries have. So we know that the numbers are underreported. There's absolutely zero doubt in anybody's mind, and it's not just Florida, it's across the nation, and it's across the world, really. And there's still so much we don't know about this. The numbers will continue to grow. Like if you remember, the New York really got a lot of pushback because they had such a high number. Then all of a sudden they added 3,000 deaths to it in like one day. And everybody's like, well, how can that be? And that's because they started looking back at all the unattended deaths and people who were symptomatic. And they're like, okay, so more than likely this person died from that. And that goes back to epidemiology. So you have a confirmed case. A confirmed case is where you actually tested the person and they have COVID-19. Then you have a suspected case, which is they had the symptoms, they were exposed, so we're thinking they are a suspected. And that's what happened where they put the suspected ones in there, okay? Does that make sense?
It does. But Florida has not done that, correct?
So, you know, you know, I used to work for the Florida Department of Health. You know, it's interesting some of the things we're seeing. I don't think anyone in public health is doing it on purpose, underreporting, but again, it all goes back to we know this has been happening probably in the United States well before February. Okay. Matter of fact, there are some estimates it probably was here November, December. So we've got a whole 4 months where we weren't doing any testing at all. And then when we were able to start testing, the testing that we had was very limited because we didn't have the mass production to be able to test it. So, and when you're testing for COVID-19, it's not an easy test to do. There's a sample you have to get, a nasopharyngeal swab, and that's pretty painful. Most people don't like that. So just thinking about getting that is pretty crazy. And then you have to have certain chemicals to react to that to actually to show, okay, this is COVID-19. So even if we wanted to have all those tests done, we didn't have the capabilities or the resources to do it. And that's unfortunate. We weren't ready to do what we should have been ready to do. So it's not just Florida, it's across the nation. But just know that 4 years from now, 5 years from now, they're probably going to say that COVID-19 deaths were probably by this point well over 150,000 instead of over 100,000.
Okay.
As we get more realistic data.
Okay. Do you think it's scary right now? Like, do you think we're opening up too fast? Because now we're seeing a lot of increases, spikes in cases.
Yeah, so I think, I mean, as we open up, we're going to see increases. There's no doubt. But we have to do something to get the economy started because so many people are suffering. So I'm a big firm believer we get that going. What we need to do is continue with our 6 feet away, our hand washing. Because again, it really comes down to, you got the germ on your hand, or someone had the germ and they breathed or sneezed or coughed and you got it and then you put it in your mouth or something like that. So if we can use good infection control measures, which is what a lot of businesses are implementing, then we're going to continue to see some normalcy. I mean, as far as we're not going to see the huge spikes like New York had. If we go back to where we're having mass parties and sick people are there, and then we're going to have issues like we did before. But we most of us know now what to do, and hopefully we're doing it. Because again, I'm not in the risk category, but my husband is. So when we go out, I make him wear a mask, and I wear a mask in most places because there's other people who are at risk. But I'm not worried about me. I'm worried about him, and that's what it's really about. Do you have loved ones that you care about, that you're concerned about, or even maybe not someone in your family, but someone you know does? So we want to protect those.
Okay, thank you.
Absolutely. And I see a question from Heather Hunt Gonzalez. So should we avoid volunteering if we have pre-existing conditions? So here's what I'm going to say. They always need people to volunteer for a variety of tasks. So if there's something that you're good at, if you're good at data entry, you may actually call ESF 15, which again does volunteer and donations, and they may say, we need somebody who can do some data entry. We don't need you to go out into the field. We don't need you to lift heavy things, but we're trying to keep spreadsheets. When people are checking in, volunteers are checking in, we have all these data sheets and we need all that entered. So I would say give them a call. If you're interested in volunteering, give them a call and say, here's what I can't do because I have things going on. You don't have to tell them what it is. But let them give you a no answer, because there may be, an opportunity for you to volunteer. So if you're interested and there's a disaster, give them a call. Any other questions?
Oh, good.
All right. I want to thank you guys so much. Again, I'm so sorry about my chihuahuas. You guys, if you have any questions, I'm going to type in my cell phone real quick. 772-643-8908, and then my email. You guys have any questions or you need anything else, or you can't find what you need, the hurricane's coming, you need more information, please reach out to me and let me know. All right. You guys have a wonderful day.
Thank you.
Thank you so much. That was awesome.